Dr. Pedro M. Rivera obtained his medical degree from the University of Puerto Rico, graduating magna cum laude as a member of the Medical Honor Society Alpha Omega Alpha. Dr. Rivera finished his ophthalmology residency at the Washington Hospital Center in Washington, D.C., serving as chief resident during his final year. He also completed a fellowship in retinal diseases at the same institution, where he later served as a clinical instructor. He is a managing partner at Greater Maryland Eye Physicians and Surgeons in Clinton, Maryland. He has special interest in macular degeneration, diabetic retinopathy, hypertensive retinopathy, and vascular retinal diseases and retinal detachments. Thank you so much for being here today, Dr. Rivera.
Thank you. Thank you. Thank you, Eden and Kelly, for the invitation, and also to PMD for giving me the chance to spend some time with you all and share some concepts and some conditions that could affect the eyes and the vision in regards or to Parkinson's disease. So do we get started? Okay. So usually I first like to start by kind of explaining how the eye works, because this kind of helps understand how conditions can affect your vision. So a healthy eye has is in charge of focusing the images that come in the form of light. There's two structures in the front of the eye, the cornea and the lens of the eye, which focus the image onto the retina, which lines the inside of the eye. So the lens and the cornea can be thought as lenses. So the eye, usually you can think about the eye as a camera, and it works very similar to a camera. So the lens and the cornea will be lenses of the eye. The retina, which is the layer of tissue that lines the inside of the eye, will be similar to the film of the camera. So it's in charge of picking up the image that comes into the eye. And in turn, it relays that image onto the brain via the optic nerve. And the optic nerve just sends impulses to the brain so the brain can analyze the images that the eye is picking up. It's important to understand that many of the conditions that affect the vision in relation to Parkinson's can also be seen with aging. So it's important to differentiate between the two. Things like the lens of the eye and the front of the eye can turn cloudy over time, and that we call a cataract, and that can affect the vision. There are conditions that can affect the retina, such as macular degeneration. In this diagram here, if you see, the macula is the central part of the retina, and that area can be affected in patients who have genetic predisposition for this condition. And some conditions can affect the optic nerve, and we usually call those glaucoma. So it's important to understand that aging causes some changes in the vision, and these changes are not always associated with Parkinson's, but some of them can be similar. Some of the symptoms can be similar. So again, cataracts, which is the clouding of the lens of the eye. Presbyopia is the inability to focus images up close, and that's something that happens to most of us as we age, typically after 40. So that's why many of us use reading glasses after the age of 40. Dryness is also a very common condition that affects patients as they age, and is also a very common condition in Parkinson's, as we will discuss. Glaucoma is a condition that affects the optic nerve. Macular degeneration affects the retina, the central part, and patients who are diabetics can also suffer from diabetic retinopathy. And these are all conditions that can happen as we age, unrelated to Parkinson's. So let's talk now about the conditions that are commonly seen with Parkinson's disease, okay? Parkinson's can affect the movement of the eyes, and there are several movements that the eyes perform when we're reading or looking at moving objects, and we will discuss those in detail shortly. Conditions of dryness are also very common. Dry eye syndrome and surface eye disease, very common in patients with Parkinson's. There are blinking abnormalities that can also occur in Parkinson's. impaired contrast sensitivity and color vision, and sometimes visual hallucinations. It's also important to say now that patients with Parkinson's may experience some of these conditions and they may not. And some patients may experience more than one condition, and some patients may experience absolutely none of these conditions. So it's not a given that if you have Parkinson's, you're going to be experiencing some of these problems, but these are problems that patients with Parkinson's can experience, and the incidence of these conditions in patients with Parkinson's is higher than that in the general population. Let's talk first about the movement problems and the blinking problems, okay? So there are important movements of the eye that we do, especially when reading or looking at objects in detail. The smooth pursuit is when you follow something that is moving. So when you're reading, for example, you follow from the beginning of the sentence and you follow that sentence all the way to the end, and that will be considered a smooth pursuit. At the end of the sentence, you go back to the first sentence, and that is a saccadic movement. So you go smooth pursuit and then a saccadic movement to the front. Smooth and saccadic again. And convergence is when the eyes turn slightly in. When we read or use near vision, our eyes, which should be perfectly aligned, looking straight ahead at distance, turn slightly in, and that's called convergence. All of these movements, which are very important for reading, can be affected in the setting of Parkinson's. So if you can imagine, if you have problems with any of these, that you could have trouble with reading. Sometimes you can experience double vision. Sometimes it's more vague. Sometimes you just feel like you're just fatigued and tired when you read and you're not enjoying reading anymore. And fortunately, many of these conditions can be treated, and the convergence insufficiency can be corrected with prism in the glasses, which we'll talk a little bit more about that shortly. Another thing that can happen with Parkinson's is that the blinking reflex is blunted. So you have a decreased frequency of blinking. Most of us blink somewhere between 20 and 30 times per minute. But patients with Parkinson's tend to blink less frequently, and that contributes to dryness of the eyes. And we'll talk about how to treat it with ocular lubricants and other things like that shortly. Blepharospasm and apraxia are problems that occur when the eyes close and it's difficult to open them. Blepharospasm is a spontaneous closure of the eyelids, so the eyelids close spontaneously or involuntarily, and then you have a hard time opening them. Apraxia, on the other hand, is when you close your eyes purposely, but then you have a hard time opening them. And if you are experiencing any of these conditions, they can be treated with botulinum injections. And of course, for that, you would need the assistance of a healthcare professional. Now, like we discussed, dryness is very common in patients with Parkinson's. Dryness is actually very common in aging patients in general, but there is particularly bothersome in patients with Parkinson's for the reasons that we have discussed already. These are some of the common symptoms that patients experience when the eyes are dry. There's burning or stinging, some blurred vision, especially when you're reading. There's a gritty sensation on the eyes. Sometimes they feel red or irritated. They can even become painful. And ironically, sometimes they're teary. They tear all the time, and patients have a hard time understanding why are my eyes dry if I'm tearing all the time. And it's that your eyes are trying to compensate by creating excess water from your lacrimal gland, but the tear film is not just water. It has fat from some glands on the eyelid margin and mucus from some glands on the surface of the eye. And you have to have those three ingredients in the right proportion to have an adequate tear film. So if your eyes are dry and your lacrimal gland gets overactive, only water is coming out and the two other ingredients are not keeping up. So even though you're tearing, you're still dry, and you're tearing because you are dry. Fortunately for dryness, it's easy to start treating that, and most of you can do that by just starting with over-the-counter lubricants, which is exactly what usually we do in the office as first line of treatment. So somebody suffering from dry eyes, There are over-the-counter eye drops are intended for the treatment of dry eyes, not clear eyes to take the red, not for allergies, but specifically for dry eyes. Their ointments and also warm compresses are wonderful in helping with dryness, and that's something easy that is easily done at home. Taking a clean washcloth, soak it in warm water, and let that hot towel sit on your eyes for a minute or two. And these are easy things that you can do to treat dryness yourself. Alpha omega-3 fatty acids also have been proven to help in the treatment of dryness. Always check with your medical doctor to make sure you are okay to use those, since it's a tablet that you will be taking. Humidifiers at home is an easy thing to do also to treat dryness on your own. Now, if that's not enough, then there are prescription eye drops that can be given, or prescription nasal sprays that will help in the production of natural tears. There are punctal plugs, which is an office procedure, and other things that can be done in the office to also help with treatment of dryness if the over-the-counter measures are not helping. As we discussed before, patients with Parkinson's may experience trouble reading because of the movement issues and also because of the dryness. And again, sometimes they just don't, they basically feel like they're fatigued, they're not enjoying reading anymore. They feel tired when they read, and those could be symptoms of or having difficulty reading. Always start with just a good exam with a good pair of reading glasses if you have a refractive error. And sometimes it's useful to have a lens that is specifically for reading instead of having a progressive or a bifocal. And many patients with Parkinson's find those useful. Many patients in general find those useful. And you don't always need to have prescription reading glasses for that. If you know, sometimes there are over-the-counter reading glasses that you can get. They're very inexpensive. By the way, that's what I'm using right now. It's just cheap over-the-counter reading glasses. I got like 5 of these for $15. So you don't need expensive glasses as long as you know the right number to purchase. Now, if you can't harm the eyes by buying the wrong number, but you still want the right numbers so you're comfortable reading. And if you have a lens that is dedicated just for reading, it's just a lot easier to read with them than when you have a little segment at the bottom of the lens or a progressive that you have to get to in order to see well. So sometimes something as simple as dedicated reading glasses will help a lot. Treat the dryness. Again, you start with over-the-counter, like we discussed before, artificial tears, and warm compresses, humidifiers, and so on. And if that's not enough, then prescription medications for dryness, and that will help a lot if dryness is an issue with reading. If you do have convergence insufficiency, that's something that your doctor will have to diagnose. There are some simple tests in the office to diagnose that, and that can be corrected by putting prisms in the lenses. Those definitely you will have to get prescription lenses for that. They are not available over the counter because they will be specific for you and whichever deviation you have to correct that convergence insufficiency. These are less common conditions with dryness, but with Parkinson's, but they occur as well in some patients. Again, let's remember that not everybody with Parkinson's is going to experience all of these conditions. Impaired color vision and visual hallucinations are things that some patients with Parkinson's can experience. And it's related to the dopamine neurotransmitter because we have that in the retina as well as in the brain. And sometimes the symptoms are related either to the decrease in the dopamine that is available or as a side effect of the medications that are used to treat Parkinson's. If you are experiencing any of these, then this is something you definitely have to discuss with your doctor, usually your neurologist, and sometimes adjusting your medications is going to help a great deal with that. So these are definitely things that you have to discuss with your doctor if you're experiencing them. Color vision impairment means that, the colors might not be as clear. Do remember that as we age, that happens too, but it happens very gradually. So most patients are not aware about that. And it happens because as we get cataracts, the cataract starts to impair our ability to see colors. But if you feel that there's an issue with colors, then you should discuss that with your doctor. Hallucinations means is you're seeing something that is not there, right? That it's real to you, but it's you know that it's not there, or people tell you it's not there. And it could be form or unformed, but most patients with Parkinson's see form hallucinations. Form means there's an object, a flower, a dog, a person passing, versus unformed will be like objects and lights and things like that. So most patients with Parkinson's who are experiencing visual hallucinations will be a form hallucination, something that is like a dog, let's say, or flowers, pattern flowers and things. There are many other conditions that can cause visual hallucinations, not just Parkinson's. So these are things that it's important to discuss with your doctor if you are experiencing them. Now, these are simple things that everybody should be doing it as we age, and some simple things that can help in patients with Parkinson's. There's always, like we said at the very beginning, there are many conditions that occur as we age. So if you're having any issues with your vision, the first thing you should do is get a full eye exam, because that way they can detect aging changes that could be completely unrelated to Parkinson's. They can also detect issues related to Parkinson's and treat those. Treatment for dryness, like we discussed with lubricating eye drops and warm compresses, that's something that you can do easily at home. Consider always separate reading glasses if you're having issues with reading. And also if you have, again, issues with double vision or difficulty opening your eyes, color vision problems, hallucinations, those are issues that you must discuss with your doctor, because these are issues that require medical attention and not something that you can handle easily at home. I think that basically concludes what I wanted to say, and I'll be happy to answer any questions anybody may have.
We have a question. What is meant by convergence insufficiency?
So convergence, when we are looking at distance at infinity, our eyes should be properly aligned.
Mm-hmm.
When we converge the eyes, they turn slightly in. We all do that. We don't realize we're doing it because it's a very slight conversion, but it happens nevertheless in all of us when we read. If you have insufficiency, that means your eyes, when you're reading, they're not turning in. And what happens is the reason the eyes turn in to focus on something that is up close is to avoid double vision. If you don't have full convergence, then you can experience double vision, or sometimes you can experience eye fatigue. Sometimes it's so minimal that you don't get a double image, but you get like a slight shadow. And over time, because the eyes are trying to adjust, then you start to feel that the eyes are tired. And that is called convergence insufficiency. Again, eyes are straight ahead, looking at distance or infinity, and then they converge, they turn slightly in when we read. If you have problems with that, and you cannot turn the eyes yourself, then prisms can be placed on the lenses, and the prisms will deviate that image to the right position and solve the problem.
I have a question about convergence insufficiency. Needs prisms greater than 5. Are there levels of prisms?
Yes, that's why you need to be measured for that, because like I said, you can have a very slight convergence insufficiency or a very large one. So they first will measure the amount of deviation that you have, and the prisms will be prescribed according to that. And they have numbers. It's like 1, 2, 3, 4 prism diopters is the unit we use, prism diopters. And that the larger the number, the more prismatic effect the lens is going to have, meaning the more deviation the lens provides to the image.
Are there any eye vitamins that people should be using?
Yes, there are eye vitamins, and no, there are no eye vitamins that people should be using regularly. Now, eye vitamins should be used in the setting of macular degeneration. These are the guidelines of the American Academy of Ophthalmology. And these guidelines are based on studies. So there is a preparation of vitamins that is recommended for the treatment of dry macular degeneration. If you have dry macular degeneration and you have been diagnosed with that, then you should be using these vitamins. At least is recommended. For most of us, there's no need to be using vitamins for your vision. You should have a healthy lifestyle and a healthy diet with a balanced diet with the vegetables and fruits and low in fat and your good protein intake as well. As long as you have a good balanced diet, then there's no need to use eye vitamins. If for some reason your diet is lacking there's many reasons why that can happen, then talk to your doctor about a vitamin supplement that is probably needed not just for your eyes, but your overall health. But regularly, patients do not need to be taking vitamins for the eye unless it is recommended by the physician.
Does binocular vision dysfunction go along with Parkinson's, or is that something separate?
Yeah, that is considered part of the convergence insufficiency. So binocular vision is what we do normally when you have good vision out of both eyes and you have both eyes focused in the same image. But sometimes when Parkinson's, if the convergence is lacking, or sometimes it can have deviation in the eyes and you lose binocularity. And one of the common symptoms of that is double vision. So if you have double vision, that's definitely something to discuss with your medical doctor.
And somebody did ask where you're located, so I did put your office in the chat and located in Clinton, Maryland.
Yes.
Someone asked, do you need a specific Parkinson's specialist to do this, or can a regular ophthalmologist work with prisms?
Most ophthalmologists do, not all work with prisms. For example, I don't work with prisms. So if somebody has that problem, I will send them to one of my colleagues that do that. One time I asked, what would be the best eye doctor to see if I have Parkinson's? So I think that either a general ophthalmologist or a pediatric ophthalmologist are really good. The other one will be a neuro-ophthalmologist. So a comprehensive ophthalmologist oftentimes will be able to treat and any of these conditions, and many of them are experienced enough to prescribe prisms. And if they're not, they probably know somebody that can do it. If you want somebody who specializes in prisms, the pediatric ophthalmologists do that because many kids have deviation in the eyes. So they're pediatric doctors, but they're also specialized in adult strabismus. They're not doctors just for kids, even though we call them pediatric ophthalmologists. So they do take care of adults as well. And also neuro-ophthalmologists are quite versed and experienced prescribing prisms because many patients who have strokes and things like that also can end up with double vision, and prisms are prescribed in that setting as well. So either a comprehensive, a pediatric ophthalmologist, or a neuro-ophthalmologist. That will be anybody should be able to guide you in the right direction, but I think those will be the three subspecialties in our field that will be most useful for patients with Parkinson's.
I know you had said that you really were not necessarily thinking that just because there are eye vitamins out there, people should take them. But someone did ask, what would they be called if they're for dry eyes?
So for dry eyes, the omega, well, this is not a vitamin, it's a fatty acid. It's omega-3 is a fatty acid for dry eyes. And that it's basically the fish oil tablets, right? So those have been proven to help with dryness. Now, when it comes to eye vitamins, there's a preparation that is used for macular degeneration. The preparation has a formula. The formula is AREDS number 2. This is the second version of this. This is a formula that was designed or put together at the NIH. And it was studied for over 10 years to prove that it was effective. And it was proven to be effective. It took 10 years because the help is minimal. So when you have minimal help, it usually takes a long time to be able to prove that in a statistically significant manner. And that is the vitamin that is recommended for macular degeneration, but not for Parkinson's. And for dryness, then it's omega-3 fish oil tablets, basically.
Now, some people with Parkinson's also have cervical dystonia where the neck pulls, and that can affect the eye alignment. Can
Absolutely.
prisms correct in that situation?
Yeah. That's a tricky one, but yes, prisms can if the position is it's permanent, then prisms can be prescribed for that. If it's a position that changes and it's not always constant, then it might be a little trickier to do that. But there's always things that can be done for things like that. You definitely will need a specialist for that. That is very experienced with prisms to be able to help in that situation. But most patients with dystonia of the neck can be helped, and they can start to enjoy reading again and things like that by providing the proper correction, making sure you have the proper glasses, any prisms placed in there, and optimizing any other conditions of the eye that could be contributing to the problem.
Is there a limit as to the amount of prisms available in glasses?
Yes, there's a limit to everything, but if the patient has a deviation that is greater than the prisms, then surgery can be done to correct that. But surgery is usually not required for convergence insufficiency. The deviation wouldn't be great enough for that. But there are other conditions, not necessarily associated with Parkinson's, more with strokes or problems in the eye, where the deviation is too great, cannot be corrected with prisms, then surgery can be done in the muscles of the eye to realign the eyes. And for that, you definitely need, usually that surgery is done by pediatric ophthalmologists and adult strabismus specialists.
And someone asked about what are nystagmus, and is this in any way connected to Parkinson's?
Astigmatism?
It says nystagmus,
Oh,
Nysti.
nystagmus, yeah. Oh,
Nystagmus.
yes. So nystagmus is a condition where the eyes are kind of dancing, let's call it. Okay, there's many reasons why people can have nystagmus. Sometimes it's congenital. If you have, that means you were born with it or develop it shortly after birth. And if that's the case, it's because your eyes don't see well. And as far as I know, I don't think nystagmus has been associated with Parkinson's, but nystagmus is sometimes acquired. If nystagmus is acquired, there is a problem, and there's many different problems, and it's a problem that is affecting your brain. It could be an inflammatory problem, it could be a stroke, it could be other issues, masses, and things like that. If somebody has nystagmus of adult onset nystagmus, you must go see a doctor. Okay, you definitely need to see a doctor as soon as possible, I may add. Now, if you were born with nystagmus, then you have congenital nystagmus is something that affects the vision, because if the eyes are moving, it's hard to fixate on a target when the eyes have this involuntary movement from side to side. But again, there are some treatments that can be done, and even sometimes surgery that can be done to kind of stabilize and minimize that movement of the eye. Anybody developing nystagmus, as an adult needs to get checked quickly.
And then, are there tests that are additional to the standard eye tests? She's asking because her loved one basically has just gotten progressively can't started 3 to 4 years ago, couldn't read newspapers, then it became magazines, then it became books, now not even full sentences. Are there extra tests that can be done?
Absolutely. The first is to start with a full eye exam, because again, there's, like we discussed at the very beginning, there's cataracts, glaucoma, macular degeneration, retinopathy. There's many other conditions that can affect the vision. Parkinson's by itself is going to be rarely the cause of progressive visual loss to that degree. So if somebody is losing vision like that, I will start looking for other conditions that are the culprit or that explain these, and most of those can be treated. Of course, that's what we do. So we can treat those things and try to correct them to the best of our abilities. So Parkinson's can have problems with the vision that are transient, but if you have progressive visual loss, Parkinson's is not the first thing that comes to mind.
Can there be a deficiency in number or function of the rods and cones in the retina?
Yeah, that's something that happens, one, with aging, something that happens with Parkinson's because it's considered a degenerative condition. Alzheimer's also causes that, or pathologic conditions of the eye. Again, macular degeneration, hypertensive retinopathy, diabetic retinopathy, any glaucoma as well. Any condition that affects either your retina or your optic nerve. So the retina, again, it's that layer that lines the inside of the eye. I don't know if we can go back to the first slide, but the retina is the layer that lines the inside of the eye. And the retina is similar to brain inside of your eye. It forms from the same tissue that forms your brain. And it works very similar to the brain. So right there, you see the retina, which is that layer that lines the inside of the eye in orange in this drawing. And also the optic nerve is part of brain tissue. So all of those conditions can degenerate over time, just like there are degenerations that occur at the level of the brain. And conditions such as Parkinson's and Alzheimer's can affect the retina and the optic nerve, in addition to many other conditions that affect the brain.
And what can you do if prism lenses don't work?
If prisms are not working, I imagine this person has somebody overseeing and prescribing the prisms. If the prisms are not working to control the symptoms, I guess I'm thinking these are double vision symptoms, then you have to ask at least the possibility of surgical intervention to correct the problem, to see if surgery can solve it. If that's not possible, then picking the better of the two eyes and covering the second eye will get rid of the double vision if it's monocular. So if you have problem in the eyes are not aligned, the prisms are not correcting, they cannot do surgery, then you usually will cover the weaker of the two eyes and leave the better eye uncovered, and that will get rid of your double vision, at least on temporary basis. But obviously that's not ideal. So the first step will be to talk to your doctor to see if there's any surgery that can be offered for the condition that is causing the double vision.
Somebody actually, as they're talking about the double vision, they experience it while driving, where the lanes ahead start to overlap or an additional lane appears. They correct it usually by closing one eye, but are there other suggestions they can do?
Prisms. Prisms. Yeah, this is somebody who probably have insufficiency. That most likely what's happening here, instead of not turning in, is that one eye is turning out. We call that exotropia, and that happens a lot because this person is driving. So this person is not really reading. We don't expect convergence. When you're driving, you're looking straight ahead. But sometimes one eye starts to wander out, and that's called exotropia. And that, if it starts to affect the driving, prisms can be prescribed to realign the image. Or if it's happening a lot and you don't want the prisms, surgery can be offered to realign the eye. So the prisms realign the image, but the eye still deviated. Surgery realigns the eyes.
I have a few questions coming up, basically asking if this is because of Parkinson's or related to Parkinson's. Are cataracts related to Parkinson's?
No, cataracts are related to aging. We all get cataracts, all of us. Everybody gets cataracts, just like we all get gray hairs and few wrinkles as we go along. So cataract is the normal aging process of the eye. It's not a disease, but at some point, cataract starts to affect your ability to see. So whenever the cataracts are causing problems with your ability to function, because it's impairing your vision to the level that either you're having trouble reading or driving or doing anything that you want to do with your vision, then cataract surgery can be considered. Cataract surgery these days is it's a routine surgery. It's a major surgery, but it's routine, and success rate of cataract surgery is very high. So it's usually a procedure that for most patients has a very good result. Like any procedure, there could be complications, but statistically speaking, the chances that patients will see better after cataract surgery is way above 90%.
And then again, also, can you explain floppy eye syndrome, and is this related to Parkinson's at all?
Yeah, that's actually one that could be actually related to Parkinson's, but not the floppiness per se as much as the one that sometimes the eyes just close. But floppy eyelid syndrome has to do with laxity of the eyes. Now, sometimes you have a combination of those. So not infrequently, patients that have Parkinson's could eventually have floppy eye because of what's going on with the eyes and the treatments that are being given. But floppy eyelid syndrome happens a lot in patients who have allergies because they tend to rub their eyes, which is not a good idea. So if you have allergies, there are eye drops for that, so you don't rub the eyes, because when you do that, you start to weaken the tissues that keep the eyelid in place. So as time goes on, if those tissues that are supposed to stabilize the eyelid are weak, then your eyelid can flip very easily, and it can do it at night. It can do it spontaneously. So you will have irritation, you would have foreign body sensation, feeling like something is on the eyes, redness, irritation. You can even have an abrasion on the eyes. And for floppy eye, it's not my area of expertise, but sometimes there are some procedures that can be done to tighten the eyelids, to give more firmness to the eyelid. If it's too lax and it's flipping too easily, they can tighten the eyelids on the side so they don't flip with as much ease.
Can you talk about what is visual snow syndrome, and is that related to Parkinson's at all? I told you a lot of these
So
were related.
no, I'm surprised somebody knows about visual snow syndrome. That's a very uncommon condition. Is poorly understood. To my knowledge, it has not been linked to Parkinson's, but again, this is a condition that is not well understood. Basically, patients who have visual snow syndrome, when they look at things, sometimes they look like things are pixelated, okay? And it has been linked to anxiety, and sometimes you use medications that anxiolytic medications to control the symptoms, okay? Visual snow syndrome is annoying, but it's not going to cause blindness. So it's not a condition that is going to take your vision away. But it's basically looking at things. And the reason it's called visual snow is some people, when they first started to describe these, they look at things. It's like light snow falling here. That's what I see when I look at images. And again, it's like a pixelation. Now that we're in the computer age, people can understand what pixelation on the image that you're seeing. And normally you see that with both eyes, because this is something that is happening at the level of the brain. That's one thing that we think, that because it's happening in both eyes at the same time, the problem is in the level of the brain. So any condition that affects your visual input could be contributing to that. Again, I am not aware that it has been linked to Parkinson's, but I wouldn't be surprised if at some point somebody finds some kind of relationship with that, or with Alzheimer's, or any of the other degenerative conditions. The caveat, though, is that most patients with this condition tend to be on the younger side, and these are not typically the patients who have more problems with degenerative conditions. So again, I'm not an expert on this matter, but if you are having that, I would encourage the patient to see a neuro-ophthalmologist, okay? And it's difficult to treat. Nobody really knows why it happens, but sometimes anxiolytic agents, things that can be prescribed for anxiety, can be helpful. I'm surprised somebody knows about that.
Well, I didn't know about it, so I just read the question.
It's rare. It's not very common. It's very rare.
Should someone keep reading if their eyes are dry, burning, or blurry, or is that harmful if they continue?
No, it's uncomfortable, but not quite harmful. This is what I would do. If you're experiencing that, take a break, put the lubricating eye drops. You can even put a warm compress over the eyes for a minute or so if you have the time, but at least put some lubricating eye drops, take a 5 minutes break, and then try it again. You're not going to harm your eyes, irreversibly by doing something like that, but you will be uncomfortable. And if it starts to be very uncomfortable, then you're going to stop reading anyway. And if that's happening, then it's probably time to consider prescription eye drops for dryness, and or prescription nasal spray. There's a nasal spray that can be prescribed for patients who have trouble putting eye drops, or prescription eye drops that you use in conjunction with lubricating eye drops for dryness. But trying to read when your eyes are burning or bothering you, it's not going to harm you. You're just going to be a little uncomfortable, and at some point you're going to quit.
And if using Botox to treat for blepharospasm, is there a long-term effect to your vision?
Not to the vision, but to the position of the eyes and the muscles, because Botox is paralyzing the muscles. So sometimes you start to get atrophy of the muscles around where the medication is injected, but not to the vision itself, not to the vision, just to the your facial expressions and your eyelid position and things like that could over time start to change with multiple Botox injections.
And then you had mentioned the Botox injections. Someone asked if they're at a point now where their eyes can't stay open for 4 hours after they wake up. So they've had Parkinson's medications, they're taking a stimulant, it's not improving. Are there other recommendations? They're getting Botox every 4 months. Would they need to increase what could they do to treat that when their eyes basically just aren't staying open?
So they're using Botox
Yes,
already every 4 months?
every 4 months.
That is a question for the specialist, because that sounds like yeah, that's when you really need somebody who specializes in these type of conditions, somebody who is a neuro-ophthalmologist, somebody who has experience with Parkinson's disease and with Botox, because it sounds like that's a very recalcitrant situation. And I don't have a lot of experience with that. And I cannot think of something other than continue with the Botox, or maybe increasing the dose of the Botox, or increasing the frequency of the treatment if that's possible. I don't do that, so I don't know exactly how to treat, but I can also say that is an unusual enough condition that you need somebody who really subspecializes in these type of problems. And if you're, I'm sure that person has a good doctor, but sometimes getting a second opinion from somebody who specializes in that may help look at other options here. But I cannot think of anything besides just maybe increasing the frequency of the injections or increasing the dose of the medication that is injected.
Yeah, question. What causes, well, first, could you talk about what nerve palsy is, what causes it, and is it a type of stroke?
So nerve palsy, so in relation to the eyes, the nerves control the movements of the eyes. And we have muscles that move the eyes to the outside, to the inside, up and down, and there are different nerves. There's 3 nerves that are in charge of those type of muscles. Or those movements in the muscle. Sometimes a palsy means that you've had a paralysis of that nerve. And it's like a mini stroke, but it's not like a major stroke. Now sometimes you can have a palsy related to a stroke as well. So there's many reasons why the muscle is not moving. So the palsy per se means that the movement of the eye has been impaired. But most of the time, we save the term for when the problem is in relation to the muscle itself or the nerves that innervates that muscle. If that happens, there's many reasons why that can happen. Most of the time, it could be related to things like diabetes and hypertension. And sometimes these pulses are transient. They usually last 4 to 8 weeks and they resolve spontaneously. But anybody who has a palsy needs to get checked, because that could also be an early sign from a stroke that is causing a problem in the centers of the brain that are in charge of the eye movement. So the eye moves through the nerves and the muscles, but it's controlled by your brain. So if you have a stroke in the area of the brain that is in charge of moving your eyes, you could have a palsy as well. So palsies at the beginning, first you have to determine what's causing the palsy. But if it's a transient one and we think that everything is okay with the brain, it's probably happening at the level of the muscle, then you can either cover one eye because we expect that that's going to go away in a month or two, or just do temporary prisms. There are temporary prisms that are attached to the lens, to the back. They're called fresnel prisms, and they can temporarily relieve your symptoms until the problem goes away. Again, we expect a month or two. But if it's a problem related to a stroke, then usually prisms are going to have to be required because typically, even though it can get better, it's never going to go completely away. If prisms are not enough, then surgery is something that can be done, but typically you have to wait no less than 6 months before you start to consider surgical intervention.
What about difficulty driving at night? Like the lights are refracted. Are there special glasses for that? Or like you mentioned reading glasses, but what about that?
Yeah, sometimes that's a very common symptom of cataract. So it could be related to cataracts. It could be other things as well. But the first thing is to make sure you have good glasses because if you have a refractive error, just kind of making that image sharp is going to help a lot. Sometimes patients, when they have issues with glare, some patients, and I emphasize some, patients find yellow tinted lenses useful for that. They call them night driving glasses. So if you if you go to a search engine and try to buy things online and you go and say night driving glasses, they're going to show you these lenses that usually have a yellow lens. They also shooters also use those lenses, so you can find them in the sporting goods stores as well. And some patients find those lenses very useful. They're yellow tinted. You can use them during the day, overcast days, or at night because they're not that dark. And if you have a little bit of glare issue, then that can help with that. But most patients experiencing trouble with night driving have cataracts, and those lenses are not going to be that helpful for cataracts. Cataract surgery will be helpful for that. But if you're still experiencing the problem after cataract surgery, then those lenses can be useful, the yellow lenses.
Are multifocal cataract lenses more difficult for someone with Parkinson's versus someone without?
That's a great question. Hmm. I don't know the answer really. That's a great question, actually. Um, I would encourage this person to talk to the cataract surgeon and ask that. I do retina, so I don't do refractive cataract surgery. The way these lenses, there are many different lenses, and that's one thing I know that there's different options for lenses, and some lenses are better for certain conditions than others. I am not really sure whether there will be an issue. Um, if you do have convergence insufficiency, that could be a bit of a problem with multi focal lenses for sure. So I think I would be cautious with that, and it is definitely a discussion to have with your cataract surgeon prior to surgery, and make sure that this doctor understands the fact that you have Parkinson's. Make sure they have a good examination to check whether you have convergence insufficiency or not. Because even though I don't know for a fact, I suspect that you would have issues with these lenses if you have some sort of convergence insufficiency because they cannot put the prisms in the lenses that go inside of the eye, though they could prescribe prism glasses after that. But if you're having refractive cataract surgery, you probably don't want the glasses, so that would defeat the purpose. But great question, and don't know that I don't know the answer 100% with 100% certainty, but it's an important question to ask whoever is going to do the cataract surgery for you.
Is snow vision the same as seeing pepper heavily scattered across the field of vision?
Patients with visual nose syndrome describe it in many different ways, and someone might feel like that's what it is. But many times when you have these type of peppering uh, effect on your vision, you need to have an eye exam just to be sure. Because the first thing you need to do before you start to attach it to visual nose syndrome, most of the patients that have these type of phenomena have a reason in the eye for having it, okay? Either floaters, inflammation in the eye, bleeding in the eye. There's many things that can cause these type of visual symptom. Once you do a full eye exam and you have ruled all of those things out, then you start to look into the very rare. Remember, visual nose syndrome is very rare, very rare. So most patients that are having these do not have visual nose syndrome. It's a diagnosis of exclusion, meaning that you have to do a full eye exam before you start to attach that symptom to visual nose syndrome.
I'm going to try and pronounce this.
Yeah.
What are the differences between meibomian gland
Yeah.
dysfunction and
Dysfunction.
blepharitis? Okay, as long as you know what I'm talking
Yeah, very similar. So blepharitis, they're about the same, to be honest with you. It's kind of all a spectrum. So initially, at the very beginning, when we were talking about dry eye syndrome, I was mentioning the fact that sometimes, ironically, you're tearing and your eyes are dry. And I mentioned the fact that the tears have three components. Water comes from the lacrimal gland, mucin or mucus that are some glands on the eye surface itself, and there's some oily glands on the eyelid margin of both eyelids, up and down, that are called meibomian gland. These are oil fatty glands. Okay, we have them throughout our body. Like that's what keeps our skin moist, and in the eyelids, it contributes a fatty secretion that retards the evaporation of tears. So when the tear film is healthy, you have that mix of water, the mucus, and the fat. And the purpose of the fat is so that the tear that is on your eyes doesn't evaporate quickly. Now, when the fatty component is lacking, that's called meibomian gland dysfunction. The glands are not functioning like they're supposed to, so the tear evaporates very quickly and your eyes get dry. And that's why sometimes your lacrimal gland starts to get overactive. You're tearing, but only water is coming out, no fat, and it's still evaporating. You're still dry. So blepharitis is part of the spectrum of that because bleph means eyelid and itis means inflammation. Many times patients have meibomian gland dysfunction because there is inflammation of the eyelid margin, which we call blepharitis. Now, there are many forms of blepharitis, and meibomian gland dysfunction is one of the forms of blepharitis. There are also eczematous blepharitis, squamous blepharitis, infectious blepharitis. So blepharitis is a term that means there's inflammation on the eyelid margin, and meibomian gland dysfunction is the most common reason why that happens. To treat that, you treat that first with warm compresses, which is why we go back to what we were saying about treating dry eyes. You treat it with eye drops and warm compresses because many patients have meibomian gland dysfunction, and that's exactly the purpose of the warm compress, to help with that. And if that's not enough, then the prescription eye drops that are used for blepharitis or for meibomian gland dysfunction are anti-inflammatory medications. They're going to quiet down that inflammation that you have in the eyelid. So I think I think it puts everything together now with dryness and all of that, right? Yeah.
Would drifting images in vision be related to medication fluctuations?
It definitely can be. It definitely can be. Somebody also, the person who asked about visual nose syndrome, that's another thing that can be experienced with visual nose syndrome. But yes, and the perception of the image can be, of the moving image can be segmented sometimes in conditions such as Parkinson's, visual nose syndrome, Alzheimer's, and things like that, because it interferes with the transmission of the neurons or the neurotransmitters that are working in the retina, the optic nerve, as well as in the brain.
Can anything be done for floaters?
Well, floaters is one of those things that we get as we age, okay? So Most of the times, sooner or later, patients develop floaters in one eye or the other. The condition that causes that, the medical term for that typically is a posterior vitreous detachment. If we can go quickly to that image of the eye, the central part of the eye is not empty, it's filled with a clear gel known as the vitreous. And that vitreous that fills the central part of the eye over time degenerates. So right in front of the retina, if we get the image there, right in the central part, what looks like orange here, it's not empty, it's filled with a clear gel known as the vitreous. When we were first born, the vitreous fills the entire cavity front to back and side to side. But as we age, and it happens in all of us, that vitreous starts to degenerate, and the vitreous degenerates, starts to shrink, and it starts to pull away from the wall of the eyes, starting from the front and ending up at the optic nerve. Typically, when the vitreous separates from the optic nerve, which is in the back of the eye, we call that a posterior vitreous detachment. We usually call it PVD by the acronym for short. When patients get a posterior vitreous detachment, they're going to experience floaters, sometimes experience flashes of lights. Anybody who experiences floaters for the first time should have an eye examination, because 1 to 2% of the time, or actually up to 4% of the time, patients can get retinal tears in association with the detachment. If you have a retinal tear, that needs to be treated with laser to avoid a retinal detachment that can take vision away. But most patients with floaters are not going to have that. What happens over time is that these floaters are going to start to drift down away from your visual axis by the pull of gravity. And even though they will be there, they won't be as bothersome to patients. So typically, for most patients, we encourage them to wait, because as annoying as the floaters are when they first show up, over time, they won't be as bothered. The floaters will be there, but they won't, at some point, they're not even aware that they're there, because they have floated away from the visual axis and the brain will start to ignore them. There are always a few patients that are still bothered by the floaters despite 6 or 12 months later. So sometimes there's lysis that you can do with laser to pulverize the floaters, or surgery to remove the floaters. But those, it's uncommon that patients require that.
Okay. And now I love this question from an occupational therapist. Do you have any recommendations from a therapy standpoint that could be included in treatment to promote healthy vision?
To promote healthy vision, the first thing is, healthy lifestyles, right? Healthy lifestyles. For therapy itself for healthy vision, I know sometimes patients think that doing eye exercises will help with that, but it has not been proven to be effective. It won't harm you, but it has not been proven to be too effective in helping. Some patients who have convergence insufficiency can be benefited by doing what they call pencil push-ups. They basically put a pencil or a pen, and they bring it a distance. They bring it close to them, and then bring it out and bring it close to them and out. They call that pencil push-ups. And basically what you're trying to do is get the muscles in the eye to work a little better to converge. And that's not harmful. Whether it's effective or not, it's debatable, but some people find it useful, and it won't harm you. Um, Having good illumination is always a good thing, especially when you're reading. So that's something that you should always have, get good illumination. And again, you don't want to be, especially because of dryness, in a very dry environment. So these are things that you can do at home to help with that. If you spend a lot of time in a room reading and you have problems with dryness, you can consider a humidifier for that room. If you have fans and things like that, try to have the fan not directly at you so that it doesn't dry you excessively. And again, good illumination is always good, especially when the illumination is coming from the back. You don't want the illumination coming at you, because that can cause glare. So if you're reading, you prefer to have the light coming from behind. Um, our eyes were our eyes evolved with sunlight, so there is no better light for the eyes than sunlight. So if you have a room that you can use where you have good sunlight coming and you can read with your back to where the light is coming, that will be probably ideal as well, because there's no artificial light that is better than sunlight for our eyes. So um, eyes tend to do better with that.
Well, we are out of time. This was incredible, Dr. Rivera. This was
Mhm.
so wonderful. I cannot thank you enough for taking your
My,
time to talk to
my
us
pleasure.
today. We have a tradition here at PMD Alliance. Also, this will be available tomorrow, along with the slides. So, because I know people are probably going to want to review this. But we have our wave of gratitude. Thank you to everyone for being here today. Thank you, Dr. Rivera, for sharing all your knowledge with us.
Thank you. Thank you. My pleasure.
Bye, everyone.